If you ever looked at your health insurance card or bill and look confused, this video is for you. Today, we're going to go over some of the most common health insurance terms that you need to know in order to make wiser health and financial decisions. We'll go over things like the difference between copay, co-insurances, deductibles. So by the end of this video, you'll know how to read your EOB and your doctor's bills. We're going to keep it simple, so let's dive in. First up, let's talk about premiums. Your premiums is what you pay every month to keep your health insurance active. Think about it like a subscription. Whether or not you see the doctor, you're still going to be paying this amount. For example, if you're someone who needs regular eye checkups due to a condition like glaucoma, that premium ensures that your visits are covered. Next, we have the deductible. This is the amount that you pay out of pocket before your insurance kicks in. Let's say you need cataract surgery and your deductible is $1,500. You need to pay that first before your insurance starts covering a portion of surgery. Compare that to primary care. If you see your family doctor once a year for a routine checkup, you might not even hit your deductible, depending on how much care you need, of course. Now let's talk about copays. These are flat fees you pay for specific services. For example, you might have a $25 copay to see your primary care doctor, but a $50 copay to see a specialist like me. That higher copay reflects the specialized nature of our care, whether it's managing dry eye or checking for macular degeneration. Also, here's a point of confusion. Even if you've met your deductible, you will likely still owe a copay at every visit. Then there's co-insurance. This is the percentage of cost that you share with your insurance after you met your deductible. For example, if you've already met your deductible and your cataract surgery costs $4,000, a 20% coinsurance means that you'll pay $800 and the rest will be covered by your insurance. Your out-of-pocket maximum is the amount that you'll pay in a year for covered services. After that, insurance covers 100%. So if you had a big year, say cataract surgery, once you hit that maximum, insurance takes care of the rest. This also applies to primary care. So if you had multiple hospital visits and you reach your maximum, insurance will take care of the rest. So the nice part is once you hit that out-of-pocket maximum, you typically do not have to pay your copay anymore with each office visit. Why? The insurance should be taking care of the rest. Now that we've gone over some of the basic terminology, have you noticed that explanation of benefit forms called the EOB in the mail yet? An EOB is a document that your insurance company sends after you received care. It explains what services were billed, what your insurance covers, and what you're responsible for. So let's break it down. The billed amount is what your doctor charges for a service. For example, an eye exam might cost $200. The allowed amount is the maximum that your insurance agrees to pay for that service. Let's say that your insurance only allows $150 for that eye exam. If your provider is in network, you'll only owe your portion of the allowed amount, like your copay or coinsurance. The not covered amount is what your insurance won't pay. Often this is because the service isn't covered or you saw an out-of-network provider. If there's a not covered amount, you might have to pay the difference between the billed amount and allowed amounts, a situation called balanced billing. Understanding these details can help you avoid surprises and know when to call your insurer or provider with questions. Here's some important things to think about. What is in-network versus out-of-network? In-network means that your provider has a contract with your insurance to offer services at lower rates. For example, seeing an in-network ophthalmologist might mean that your insurance covers 80% of your bill. Out-of-network means no contract, and you might pay the full amount, or sometimes a much higher percentage. Always check to see if your provider is in-network to avoid surprises. Next, sometimes your insurance requires a prior authorization for certain services. For example, if you need expensive medications for macular degeneration or dry eyes, your insurance might need to approve it first. This can also apply to primary care, like getting an MRI. These prior authorizations can take time. It often requires a back and forth between the doctor, the pharmacy, and the health insurance to get your medications or procedures covered. Sometimes an alternative is suggested by the health insurance company, and it's up to the doctor to evaluate to see if that's a good option. Lastly, here are some quick tips to help make the most out of your health insurance. Number 1, always check to see if your provider's in-network. 2, understand your deductible and out-of-pocket maximum. 3, ask about copays before your appointment. 4, use preventative care like annual eye exams that are often fully covered. And number 5, of course, always call your provider to talk with them. I hope this makes you feel more confident about your health insurance, especially when it comes to your eye health. If you found this video helpful, give it a thumbs up and share it with someone who might need it. If you want to learn a little bit more about cataract surgery, click this video right over here. Otherwise, thank you, and don't forget, as always, your eyes tell. Thanks for watching. We'll see you in the next one.